inside your body. Your liver silently processes over 500 vital functions essential for survival. Today, we re-diving deep into the science of fatty liver disease, a condition affecting nearly 25% of the global population. Understanding this condition could literally save your liver and potentially your life. Types of fatty liver. Fatty liver disease presents in two distinct categories, each with its own characteristics and causes. Alcoholic fatty liver disease. AFLD develops from excessive alcohol consumption, where the liver becomes overwhelmed processing alcohol instead of fats. The liver can accumulate fat concentrations exceeding 5% of its total weight. Clinical studies show that consuming more than 40 grams of alcohol daily for men, or 20 grams for women, significantly increases AFLD risk. Non-alcoholic fatty liver disease. NAFLD, this form affects people who drink little to no alcohol. Research indicates that 70% of type 2 diabetics and 95% of severely obese individuals develop NAFLD. The condition is strongly linked to insulin resistance, metabolic syndrome, high blood pressure, elevated blood sugar levels. Central obesity NAFLD can progress to non-alcoholic steatohepatitis, NASH, where inflammation and liver cell damage occur alongside fat accumulation. Progression stages. Fatty liver disease progresses through 4 distinct stages. Stage 1, simple fatty liver. Fat accumulates in liver cells, but minimal inflammation exists. Clinical studies show this stage is reversible with lifestyle modifications. Stage 2, steatohepatitis. Inflammation begins, and liver cells start showing damage. Research indicates this stage affects approximately 20% of NAFLD patients. Stage 3, fibrosis. Persistent inflammation leads to scarring. Studies reveal that up to 40% of patients with NASH develop fibrosis. Stage 4, cirrhosis. Extensive scarring replaces healthy liver tissue. Medical data shows this stage affects 5 to 15% of NAFLD patients within 10 years of diagnosis. Diagnostic criteria. Scientific research has established clear diagnostic indicators. Physical measurements. Waist circumference exceeding 100 centimeters in men. Waist circumference exceeding 90 centimeters in women. BMI above 30 blood tests show elevated liver enzymes, ALT and AST, increased triglycerides, higher fasting blood sugar imaging studies. Ultrasound showing increased liver echogenicity. Fibroscan indicating increased liver stiffness. MRI, revealing fat percentage in liver tissue. Treatment approaches. Evidence-based treatments for fatty liver disease include dietary modifications, implementing 12 to 16-hour fasting periods, reducing fructose intake by 50%, limiting processed carbohydrates, increasing fiber intake to 25-30 g daily, exercise protocols, 150 minutes weekly of moderate aerobic activity, resistance training 2 to 3 times per week, regular walking after meals, lifestyle changes, achieving 7 to 10% weight reduction, eliminating alcohol consumption, managing blood sugar levels, controlling blood pressure, understanding fatty liver disease is crucial for its prevention and treatment. Research proves that early intervention can completely reverse the condition. Remember, your liver is remarkably resilient. Given the right conditions, it can heal itself. The key lies in taking action before permanent damage occurs.